that have this prohibition represent 90% of the insurance market in Canada. 90%. You understand that if you were an insurance company and you want to sell a new product, like private insurance, well, you don't look at a market, you don't look after, you don't want to get after just Prince Edward Island market or Newfoundland market, right? You want a Canadian market, right? So the Canadian market is made of not only all the provinces, but all the legislation in the province. So if provincial legislation blocks off 90% of the market, well, you're not going to invest into that market. Therefore, although there were only 6 provinces prohibiting private insurance, since they represented 90%, that was strong enough to get rid of the potential private market for health insurance. The Supreme Court didn't think that, or didn't want to tell us that. I'm telling you now. And so Quebec and Ontario, being the 2 biggest provinces, and BC having it, that BC was the core protection. So we kind of protect each other through that very provincial legislation. So that's the first rule. The second one, which is very important in provincial legislation, is the prohibition for double dipping. That we say in feminine words. Double dipping means the situation where a physician could be paid at the same time from public funds and private funds. Double dipping into the 2 sauces, right? This is not called for in the Canada Health Act either. And yet, in my view, it's paramount. It's really core principle, important, crucial principle for the protection of Medicare. And it's easy to understand because, of course, you know, especially in Quebec, we have, but across the country as well, you know, some physicians say, well, we should allow physicians to double dip so they could, you know, they could work in the public system, but when they don't have work anymore, they go and work in the private or whatever, right? Well, I don't know too many physicians that don't have enough work in the public system. They have spare time in the private system. If you allow them to do both, they'll do the other way, right? They'll go and do the private practice, and when, like Dr. Chaoulli, they realize they don't have enough patients, then they'll go to the public system. So the public system can only lose from this rule of double dipping. That's why it's so important, again, you know, to have that and to fight for this principle. So, so that's the second one. And the third rule is the potential regulation by provinces about medical fees for physicians practicing outside the public system. Not many provinces have done that. But when they do, the thing to do is to say, well, you want to get out of the public health care, you want to work on your own and be paid, you know, by patients, fine, but you can't charge more than what you would get in the public system. So if you do that, then there's no interest, no incentive to get out of the public system because you can't make more money. But if it's deregulated, as it is in most provinces, then there's an incentive for physicians to opt out of the system and charge double or triple the fee for a visit, right? And then, of course, when you do that, you can have a better price, right? So that's why these 3 principles, about which we didn't pay enough attention, I think, as defender of public Medicare, are important. And we see it now because that's where things are happening with those principles. In every one of our provinces, that's what is at stake when we talk about potential, current and potential privatization of health care. And the Chaoulli decision is there to demonstrate that, because that was the very first principle that was sought after. So what are the main objectives of those provincial principles? Well, the first one, as I explain with those examples, is to avoid the cross-subsidization. To avoid that public funding are used to subsidize a private parallel system. And to ensure that the public funding for Medicare is being used for the benefit of all, as opposed to a select few when you finance a private system. That's the main purpose of provincial legislation. And when you see the way Medicare is being funded, you understand why this is not in the Canada Health Act and why it is in provincial legislation. Because the federal government is making, money transfer to provinces, right? They say, we give you money if you respect the principles that are in the 5 principles of the Canada Health Act. But what you do beyond that is your business, right? If you want to pay more, if you want to double the salary of all your physicians, for instance, that's your business, right? If you don't want to negotiate, the fees and all that, that's your business. If you want to subsidize some private medical practice, it's your business as well. The way you want to spend and control the public funding. Because once the money is transferred to the provinces, it comes under the responsibility of the province to provide the services and to pay for them. So the idea of having also private services within provinces is every province's business. But the provinces understood that, it's tough enough, right, to finance Medicare. We hear it all the time, it costs too much, and it becomes half the budget of provinces and all that. So it's tough enough to finance Medicare for all. Why should we finance private health at the same time? We can't do that. We can't do both, right? We've got to put all our money for the benefit of all, and if we put money for the private, parallel private system, we won't have enough. We have less money for the private system. So that's why these type of rulings are there within provinces and are not in the Canada Health Act. And that's why we have to care for it now, and we have to understand the way they work and to understand where we should fight to preserve Medicare. So you realize that even somebody like our Prime Minister, Conservative Prime Minister, is standing behind the Canada Health Act, right? Stephen Harper says, I support the Canada Health Act. I'm not going to change the principles. Well, we all know that he says that, but actually he would very much like to see more private enterprises in health. Why? Is he lying when he says that? No, he's not. He supports the Canada Health Act, but he supports privatization because he knows that privatization can occur outside the Canada Health Act, can occur through what is being done at the level of every province. And that's what we'll see when we look at the way things are unfolding. Taking Quebec as an example, but we'll see that things are being done also in other provinces at the same time. So, I will explain to you quickly 6 major, what I call structural changes that are occurring, that are preparing the ground for the wide-scale privatization. And I made a difference here. The first 4 changes are already in place in Quebec and in some provinces. And the 5th and 6th are being discussed and promoted in Quebec, but are not in place yet, but are in place in some provinces. So instead of reading them here, I think we'll go one by one. The first one is that's interesting because nobody saw the link between this phenomenon and privatization.